taken as inhalation of smoke. So as this smoke is entering into the lungs or into the respiratory organs, it will cause severe shwasa, means dyspnea, can cause sneezing, cough, all those symptoms will be produced. Then kasa means cough also. Then chakshusho paridahascha ragascheva upajayate. Due to that smoke or due to that uh, emitting of that substances, what happens? It will afflict the eyes also. The eyes can become red, as well as there will be burning sensation in the eyes. Tadhumakam nishvasati kayam anyatna vinutta. That is when the person exhales or inhales, there will be smoke. Smell of smoke will be there, and emitting of smoke from the nose. That also will be happening. And the other than the smell of smoke, the person will not be able to perceive other smells. Next, it is Sadevati Rasan Sarvan Shrudishasya Upanidya. That is totally the sense organs will be means rasa. There will be loss of perception of the taste. Then Shrudishasya Upanidya. He is unable to hear anything. Then Krishna Daha Dvirita other illnesses like there will be thirst, there will be burning sensation, fever, other systemic illness also will be occurring in such persons. That is the local symptoms, the sensory symptoms, as well as the other systemic illness also that is developing due to inhalation of smoke. That is explained here. Next is Shrunutasya Chikitsa. Next is its Chikitsa. सर्पिरिक्षुरसं द्राक्षां पयो वा शर्कराम्बु वा मधुराम्लो रसो वापि वमनाय प्रदापयेत् वमतः कोष्ठशुद्धिः स्यात् धूमगन्धश्च नश्यति विधिना अनेन शाम्यति सदनक्षवधुज्वरा दाहमूर्छा दृढात्मानः श्वासकासाश्च दारुणा मधुरैर्लवणाम्लैश्च कटुकै कवलग्रहे सम्यक् गृह्णाति इन्द्रियार्थान् मनश्चास्य प्रसीदति शिरोविरेचनं चास्मै दद्यात् योगेन शास्त्रवित् दुष्टिर्विशुध्यते चास्य शिरोग्रीवं च देहिना अविदाहि लघुस्निग्धम् आहारं चास्य कल्पयति. So it is told about the treatment. Here it is told that Vamana. First treatment is told like we have to go for Vamana, and for Vamana certain drugs are mentioned. Sarpi, Ikshurasa, Draksha. All these substances can be used, and with these drugs or with these medications we can do the Vamana. And it is told Vamana Vamataha Koshta Shuddhi. When the Vamana procedure is done in a proper manner, it helps in the Koshta Shuddhi, because the smoke can enter into the Koshta. Here not only means the gastrointestinal tract, but entire internal system it is indicated here. So if there is a chance that the smoke enters into the gastrointestinal tract also, that also will get cleared by the Vamana. So Vamataha Koshta Shuddhi Syat Dhumagandhasya Nuksheti. That Dhumagandha, which is told in the symptoms, that Dhumagandha will be getting relieved. Idhina anena shamyanti sadana kshavadujvara daha murcha dridhatmana shwasakasasha dharana. That is by proper Vamana, it will help in relieving the other symptoms like all those systemic illnesses, daha, murcha, dridhatmana. All those symptoms also will be relieved by proper Vamana. Then it is told Madhurei Lavana Amlesha Kaduke Kavalagrahi. We have already told that there is the sensory systems, sensory organs are also afflicted so much. So accordingly, if Kavalagraha is done with Madhura Amla Lavana Dravyas, that also will help in attaining the proper perception of the sense, means taste, smell, all those which is afflicted due to the dhuma, that will also get cleared. Manaschastya prasidati, that will result in the mana prasadana also. Then it is told about Shiro Virejana. Shiro Virejana, by Shiro Virejana, it will help. Shiro Virejana, you know, it is very much indicated in all kinds of Jatotha Vigaras. So by doing proper Shiro Virejana, that will in turn act on the Drishti Vishuddhi. That is, we have told, there will be Raga, there will be Daha and the Chakshu. So that will be relieved by proper Shiro Virejana, and all those diseases or all those symptoms associated with Jatotha, that will be relieved by Shiro Virejana. And next it is told that what kind of ahara can be given. Avidahi Lakhu Snigdham ahara. And in such a person, in addition to these treatments, the diet should be Avidahi, Lakhu and Snigdahara. The ahara should be Avidahi. It will should not cause Vidagdhavastha. It should be Lakhu and Snigdha in nature. So So that is about Bhumopahata, Lakshana and its Chikitsa. So in Chikitsa mainly Vamana, Avalagraha, Shirovirechana, these are the main treatment modalities told, and in addition to that, diet is also explained. And another thing which is explained in the chapter as such is uh, the Dagda caused by Ushnavada, Adava, Chita Varsha, Anila, etc. And for that also treatment is told. Like in Ushnavada and Adava, when that causes Dagda Avastha, then we have to go with Shita Kriya. And similarly, when Shita Varsha, Anila, etc. are causing Dagda Avastha, we have to go with Snigdha and Ushna Kriyas. Similarly, when there is lightning, all these conditions, when the dahana is caused by those factors, it is told that if that person survives, then we can go for sneha, abhyanga, parisheka, pradeha, etc. That is also told in the chapter. When we deal with the burns, we will see different kinds due to different causes, different types of burns can occur. So these can be correlated to those modern aspects. So that is what is explained in the chapter Agni Karma Vidhi. So next is about the modern correlation. Mainly Agni Karma in the modern view can be correlated to cauterization, that is the destruction of tissues by using hot instrument or electric current or caustic substances. Based on that, it is divided as electric cauterization, chemical cauterization and all. And the tool used for cauterization is called as cautery. There are various methods of cauterization, like as I have told, electric cautery, cold cautery, which is done by using carbon dioxide, then gas cautery, which is done by using specially controlled jet of burning gas, then solar cautery, Huygens cautery. So many different types are mentioned. In addition to that, different heat treatments are there, both superficial and deep. Superficial heat means in forms of hot water bottles, warm bags, heat pads, all these comes under superficial heat treatments. Similarly, deep heat treatments include this diathermy, ultrasonography, etc. That is, high frequency electric current is needed in diathermy, and this diathermy can be used to treat bursitis, sinusitis, all these conditions. It is needed. It reduces the pain, muscle spasm, inflammation, and also helps in the healing. And the mode of action, it is told like when heat is applied to the body, there will be an elevation in the temperature, which in turn causes vasodilatation, and there will be increase in the waste product elimination. Proper circulation will be means local circulation will be increased, and the metabolism will be proper. And thus, in turn, there will be reduction in the pain, and it will promote the muscle relaxation, and so it will help in relieving the pain. It will help in relieving the muscle spasm. It acts as an analgesic, and healing also will be because of good circulation. Healing also will be accelerated, and so it can be used in chronic inflammatory conditions also. That is about cauterization. Next is moxibustion. That is a traditional Chinese medicine technique which also involves the burning of a drug. A drug in the sense a small spongy herb called as mugwort or Artemisia vulgaris. So that drug is burnt, and it is burnt and kept on specific sites of body to facilitate healing. So it is the purpose of moxibustion. It is like to strengthen the blood, to stimulate the blood flow, and to maintain general health. And this therapeutic procedure also parallels Agnikarma in approach. So I have taken that also. And the method is told like the dry powder of the leaf of this drug, Artemisia vulgaris or moxa, that is used here, and hence the term or the method is termed as moxibustion. It also serves as a purpose similar to acupuncture only, that is, the application of heat over the painful area in the body. It helps in relieving the pain, and especially the center of painful area is selected, and there heating is done, and hence the results are much better. uh, it is also known that it will increase the number of red blood cells, it will increase the percentage of hemoglobin in blood, etc. are also told. And in the picture you can see, that is, the leaves of Artemisia vulgaris are dried in sunlight, and it is powdered, and it is uh, filled got into a wool-like texture, and this material known as moxa wool is kept over the side of the body, and eating is done. That is moxibustion. Next is about burns. Burns, by definition, it is defined as a wound caused by exogenous agent leading to coagulative necrosis of the tissue. And there are different causes of burns, like open fire, while cooking in the field, by with boiling liquid, burns can occur. Electrical, acid, different causes are told for burns, and based on these causes, like what means if it is from direct burning fire, if it is caused due to any chemicals, if it is caused due to any electric current or something. Based on that, classification is done. Different types of burns are told. First one is thermal injury or thermal burns. Thermal burns include the scald, that is spillage of hot liquids, then flame burns, then flash burns like exposure of natural gas, combustible liquids, contact burns. All these comes under thermal burns. Next is electrical burns. Electrical burns, that is accidental electrical contact, and that depends, the severity of the burn depends on the strength of the electrical voltage. There is low voltage and high voltage, and based on that the severity may vary, and the duration of contact also determines the severity. That is electrical burns. Next is radiation burns. UV light, X-ray, radiation therapy, all these can cause radiation burns, and the effect means the effect of the burn is determined depending on the amount of exposure to the area. That is almost similar to the other thing also. The duration and the exposure will determine the severity of the radiation burn. Then chemical burn means burns due to strong acids or strong bases, and in chemical burns the tissue destruction is more and progressive, and it is always a deep burn. That is chemical burn. Then cold injury, it is due to long-term exposure to cold or low temperature. Usually affects the fingers, toes, nose, and ears. There will be numbness, pallor, severe pain, and at the site of exposure. And intervention, it is told like we have to warm the area rapidly and continuously. Inhalation injury. Inhalation injury, that is what is correlated to Dhumo Bahada. And in inhalation injury, it has significant impact on the survivability of a burn injury. That is, it has three components: carbon monoxide intoxication, upper airway swelling, acute respiratory failure. So these three components, it can occur alone or it can occur in combination. So if these components are not that much severe, if it is occurring alone, in such conditions, the survivability will be more. The condition will not be that critical. But in conditions where all these three components are occurring in combination, and that too in a severe form, then that the condition will be life threatening. So based on that, the inhalation injury can be inconsequential as well as it can be life threatening also. That is inhalation injury. Then next is about the classification of burns. So classification of burns depending on the thickness of the skin involved. Based on the thickness of the skin involved, that is, different layers: epidermis, dermis, subcutaneous, fat muscle, all these layers are there. So based on the layers involved, the burn is classified. And first classification is like first degree. First degree means here the epidermis looks red and painful. The epidermis, the topmost layer, looks red and painful. There will not be blister formation, and the burn will heal rapidly in 5 to 7 days without any complication like scarring and all. It will heal within 5 to 7 days. That is first degree. Next is second degree. There, the affected area will be mottled. There will be red, painful blisters will be present, and it will take much more time to heal. That is around 14 to 21 days will be taken for the healing. And next is the third degree. Third degree means the affected area is charred. That is, that much burn happen, and then the area will be painless and insensitive, and the intervention also will be, it will be requiring grafting and all. That much severe burn might have happened. That is the third degree. Fourth degree means the underlying tissues are also involved, like muscles, bones, all these are also involved. That is considered as the fourth degree. That is burn classification depending on the layer of skin involved, or the depth of the skin involved. Okay, first degree, second degree, third degree, and fourth degree. Again, this based on the thickness of skin involved, there is two classifications, like partial thickness burns and full thickness burns. Partial thickness burns means it is either the first or second degree, where there is red and painful, often with blisters. But full thickness burns means it is the third degree, where, or fourth degree, where there is charring of the skin. There will be insensitivity. There will be all those complications will be associated. That is partial thickness burns and full thickness burns. That is also a classification on the basis of the thickness of skin involved. Another thing is the severity of the burn. Based on the severity of the burn, there is burn severity is assessed like mild, moderate, major, etc. Mild or minor, that is condition where it's based on the percentage of burns it is assessed. That is, in a superficial burn, if there is less than 50% of superficial burn, then it comes under the minor category. Similarly, when the partial thickness burn is less than 15%, that is also considered as minor or mild category. And full thickness burn less than 2%. All these three comes under the heading mild or minor. Next is the moderate. That is, depending on the percentage of burns, the burn severity classification is done. Burn severity classification is mild, moderate, and major. And on the basis of the percentage, we are classifying it under these headings. So we have seen about mild. Next is moderate. Moderate, the superficial burn if it is greater than 50%. So 50% of the body surface area, that is BSA indicates body surface area. So if the burn is greater than 50% in the superficial case, that comes under moderate. Similarly, partial thickness greater than 15% and full thickness greater than 2%. All those three come under moderate. Third one is critical, major or severe. In that, the partial thickness greater than 30%, full thickness greater than 10%, and inhalation injury. Those three are included under critical or major or severe category. That is the classification of burn severity classification depending on the percentage of burns. So that is another classification rule. Next, it is about the assessment. Assessment of burns, there are different techniques tool, like Wallace's roll of 9, Lund and Browder chart. Another is patient entire hand area. That is, the entire hand area is taken as 1%, and a clean piece of paper is cut to the size of the hand, and through that the percentage of burn is assessed. That is, that area is taken as 1%. So, and a piece of paper is cut in the shape of that area or according to that size, and with that paper we will assess the percentage of burns. These are the three methods widely used for assessment of burns: Wallace's rule of 9, Lund and Browder chart, and this area of palm, entire hand area when taken as 1%, and that is assessed. Next is about the pathophysiology. So in the pathophysiology, this is the Jackson's theory of thermal wounds. Jackson's theory of thermal wounds is, when a burn occurs on the skin, it causes changes on within the skin, and that could be divided into sort of three regions or three zones. These zones of the burns are described by Jackson in 1947, and so it is called the Jackson model or Jackson's theory of thermal wounds. The first zone is the zone of coagulation. Then it's the zone of stasis on the outside, and further part is the zone of hyperemia. So these are the three zones. Zone of coagulation is essentially the point of maximum damage. In this zone, there is irreversible tissue loss due to coagulation, and there we will get the coagulative necrosis. That is about zone of coagulation. Next is zone of stasis. Stasis zone is essentially characterized by decreased tissue perfusion. This ischemic zone may progress to full necrosis unless the ischemia is reversed. That is about stasis zone. Next is the third zone, that is at the outside. It is the zone of hyperemia. In this zone, tissue perfusion is increased and the tissue here is invariably recovered. It is the last zone, so it is invariably recovered unless there is severe sepsis. If there is severe sepsis and all, there also uh, the tissue destruction will be more. But other than that, it is invariably recovered. If there is no severe sepsis or prolonged hypoperfusion, that zone is told like there will be increased tissue perfusion and the tissue here is invariably recovered. And when we see the zone of stasis, that stasis zone is characterized, as I have told earlier, that stasis zone is characterized by ischemia and it may progress to full necrosis. If the ischemia is not reversed at proper time, then there will be full necrosis, complete tissue that will be there, and that will lead to further complications. So, therefore, the main aim of burn resuscitation is to increase the tissue perfusion at this zone, and we have to prevent the further damage. That is told by Jackson. That is the Jackson's model. So here in the pathophysiology, if we see, this can be taken as two. That is, in the left side it is about the superficial burn. Next is about the deep burn. In the superficial burn, you can see superficially the burn is happening, and because of that there will be damage of the keratinocytes, and there will be immune response, that the mast cells, all those cells will act, and there will be a release of cytokines. These cytokines will act differently. Like the cytokines will stimulate the nerve endings and it will cause pain. The cytokines will increase the vascular permeability and thus the fluid will be shifting from the